Urinalysis is the laboratory test most commonly performed in the medical office. Urinalysis includes a physical and chemical examination of a urine specimen. The physical examination of urine includes an assessment of the color and appearance of the urine specimen. Classifications used to describe the color of urine include light yellow, yellow, dark yellow, light amber, amber, and dark amber. Normal urine may be light yellow, which is almost colorless, yellow, or dark yellow. Abnormal colors are light amber, amber, and dark amber. Classifications used to describe the appearance of urine include clear, slightly cloudy, cloudy, and very cloudy. Freshly voided urine normally appears clear. Substances present in excess amounts in the blood are often removed by the urine. The chemical testing of urine is an indirect means of detecting abnormal amounts of chemicals in the body, which may indicate a pathological condition. Chemical testing of urine can also be used to detect the presence of a substance that does not normally appear in the urine, except when a disease is present, such as blood. The medical assistant will show you how to perform a physical assessment of a urine specimen and a chemical assessment using a Multistix 10 SG reagent strip. To check the reliability of the Multistix reagent strips, a quality control procedure should be performed each time a new container of test strips is opened, or when there is a question of reliability regarding the testing strips. CheckStix control strips are used to perform this procedure. The CheckStix control consists of a plastic strip to which 7 synthetic ingredients are attached. Before beginning, check the expiration date of the Multistix reagent strips and the CheckStix control strips. Next, you must reconstitute the control strip. The control strip is reconstituted by immersing it in a tube containing 12 milliliters of distilled water. Apply a cap on the tube and gently invert the tube back and forth for 2 minutes. Place the tube in a test tube rack and let it stand for 30 minutes. This allows the ingredients on the strip to dissolve in the water. Remove the strip from the tube and discard it in a waste container. Next, immerse a Multistix reagent strip into the control solution. Start the timer and read the results at the proper reading times. Chart the control results in the quality control log sheet. As you can see, at the top of the log sheet, you must record the name of the test, the date, the name of the control, and the lot number and expiration date of the control. Record each control result next to its expected result. This includes the results for glucose, bilirubin, ketone, specific gravity, blood, pH, protein, urobilinogen, nitrite, and leukocytes. As you can see, all of the control results are within acceptable range. If any results do not fall within their expected values, check for factors which can cause this to occur. Failure of the control to react as expected can be caused by outdated reagent strips, outdated control strips, improper storage of the strips, or an error in testing technique. The medical assistant will now perform the physical and chemical examination of the urine specimen. Begin by obtaining a freshly voided urine specimen from the patient using a clean container. A first voided morning specimen is preferred for the Multistix test, but a random specimen is acceptable. The container should be clean because contaminants in the container could affect the test results. Sanitize your hands. Assemble the equipment. You will need the Multistix 10 SG reagent strips, a paper towel, and a timer. Check the expiration date of the reagent strips. Outdated reagent strips may lead to inaccurate test results. The physical examination of the urine is performed first. Apply gloves and hold up the urine specimen in good lighting. Determine the color of the urine. Normal urine is light yellow, yellow, or dark yellow in color. The urine specimen is dark yellow in color. Now assess the appearance of the urine specimen. The appearance of this urine specimen is clear, which is normal. Chart these results. Next, the chemical examination of the urine specimen is performed. Remove a reagent strip from the plastic container. Do not touch the reagent areas with your fingers or lay the reagent strip on the table. If you need to put the strip down, you can lay it on a clean, dry paper towel. Recap the container immediately to prevent exposing the strips to moisture, light, and heat. These factors can alter the reaction of the chemical reagents on the strips, leading to inaccurate test results. Thoroughly mix the urine by rotating the specimen container. Remove the lid from the container and place it on the paper towel. Using your dominant hand, completely immerse the reagent strip in the urine specimen and remove it immediately. As you remove it, run the edge of the strip against the rim of the urine container to remove excess urine. Prolonged immersion of the reagent strip and failure to remove excess urine may cause the chemical reagents to dissolve and leach onto adjacent test pads, affecting the accuracy of the test results. With your non-dominant hand, start the timer and then pick up the reagent strip container. Rotate the container to the color chart. Hold the reagent strip in a horizontal position. Holding the strip horizontally prevents the chemical reagents from running from one reagent pad to another. If this occurs, the test results will be inaccurate. It is important to read each result at the exact time specified on the color chart. The chemical on each reagent pad needs a certain amount of time to react with the urine. If too little time is allowed, the reaction does not have enough time to take place. If too much time elapses before the results are read, the urine dissolves out the chemical on the reagent pad. Both of these situations lead to inaccurate test results. Glucose is the first test to be assessed. Place the glucose reagent pad as close as possible to its corresponding row of color blocks on the chart. Do not lay the strip directly on the chart because this would result in the urine soiling the chart. When your timer reaches 30 seconds, carefully match the color of the glucose reagent pad with the appropriate color block in the row of blocks. Look at the interpretation guide provided above each color block on the chart to determine the result. Make a mental note of this result. The glucose result for this test is negative. Bilirubin is also read at 30 seconds. Carefully match the color of the bilirubin reagent block with its corresponding color on the color chart. The result for bilirubin is negative. Continue reading the test results at the specified times. The ketone result is read at 40 seconds. The result for ketone is negative. Specific gravity is read at 45 seconds. The result for specific gravity is 1.025. Blood, pH, protein, urobilinogen, and nitrite are all read at 60 seconds or 1 minute. The result for blood is negative. The result for pH is 5. The result for protein is trace. The result for urobilinogen is normal. The result for nitrite is negative. Read the results for leukocytes at 2 minutes. The result for leukocytes is trace. Dispose of the strip and paper towel in a regular waste container. Remove your gloves and sanitize your hands. Chart the results. Most medical offices use a pre-printed reporting form to make it easier for you to record results. The recording should include the date and time, the brand name of the test used, and the result of each test.